Hey guys, Dr. Dobson, and this one's going to be a very deep class 2 restoration. This is a patient that complained of hypersensitivity to cold in the lower right, and you can see the cavity on the second premolar. Tested normal to pulp testing, no lesion on the x-ray. There's the final result, so we're going to get into the clinical footage here. Going to begin by getting a rubber dam on. And then there's the lesion there. Pretty deep one, so we know it's going to be big. Going to grab a KS1 burr for the high speed and a small carbide for the slow speed, and just get going with our preparation here. Lots of water. We know that we're going to be getting close to the pulp, so we'll try to keep the tooth as cool as we can. So we're just going to open up the buccal and lingual contacts, switch over to the 9 o'clock position, and then finishing opening them up from this position here. I'm actually just going to snip the septum. It gets in the way. Sometimes if you inadvertently clip it, it can kind of blow the whole thing apart. So there we are. Still going to be a bunch of soft tooth decay in there. So we're going to go in with our small round carbide. And still a ways to go. So we'll continue with our KS1 burr. And we're getting close. The DEJ is looking better, but still a ways to go. I like to make retentive grooves, dovetails into the occlusal surfaces of class 2s. We're getting pretty close there, just a little bit more decay on that lingual aspect, so we're going to whack that down with our slow speed. And once we've done that, I think we're pretty much going to be ready to restore, and that's pretty much good to go. A little bit of thin enamel flakes that we are going to remove some undermined enamel with the high speed. And then you can see a little bit of blushing on the pulpal floor there. That little bit of affected dentin isn't too much of a concern. We'll round off the any kind of sharp or thin enamel edges with the carbide flame. And there we are. That's that's ready to restore. So we'll grab a sectional matrix and place it down, put a wedge in. I usually like to apply some apical pressure to the matrix and then wiggle the wedge in and out to get it as far down the sulcus as possible. And then we'll put it in fully. And then the separator ring, I usually like to apply the separator ring and then give it a good shake with my fingers, kind of hold the teeth and hold the ring and kind of wiggle it back and forth. And that forces the teeth apart as much as they can go. And then I'll seat it down as apically as it can once more here. And then we have the PDLs as stretched out as they can be so that we end up with a good contact. Gonna burnish the matrix against the neighboring tooth. And then we're gonna be ready to etch, rinse, and restore. So we'll dry the tooth, apply our 5-second phosphoric acid etch. Lots of people ask questions about why do you etch for glass ionomers or glass hybrids. And I do it because it works and it's faster. Lots of papers showing that 5-second phosphoric acid etch is equivalent in shear bond strength to 15-second polyacrylic acid scrub. Gonna mostly dry it, and then there's the surface treated, ready to restore. There it is matrixed. And we're going to apply our filling material, Equia Forte. Equia Forte works really well, especially for in most indications, but especially for deep restorations because it has such a good seal and it's very pulp friendly, I find. So I wouldn't be concerned about symptoms in this tooth developing, and they haven't so far on follow-up. We're going to overfill the prep and then condense the material a bit with a moist cotton pellet to ensure tight adaptation to all the margins. And this is a time set material, so we're actually going to take a few minutes, do a recall, have a sip of coffee, and then return when it's set. So we'll come back, disassemble the matrix assembly, remove the wedge and the band, and sometimes these can be difficult, so I'll usually take an explorer and separate the occlusal portion, and then I'll use a Howe plier to tug a fin of it. Careful that you doesn't come flinging up and you bash the upper teeth. This one actually broke on us, but we have a little piece that we can grab, so we'll do that, and now we can get to finishing the filling. We'll take a large round diamond and remove any excess restorative material. And once it's mostly back down to where we want it, we'll go over it with a carbide burr, slow speed carbide. And once we're happy with the finishing, then we'll take a little explorer and make a little groove for the floss to go in. Gonna take the rubber dam off and then start checking the bite. I'll dry the material because it marks better with the bite paper. Have a patient bite down and grind hard, and I typically aim for no contact on my direct restorations. We'll wipe off the ink, dry the material, and then apply our varnish agent, Aqua Coat. That's going to get painted on. I'll usually air thin it. Gets light cured, and then that's pretty much good to go. We're going to give the, make sure we can get in with the floss, give it a quick floss to check the contact, and then we'll dismiss the patient. Tell them that there's a chance of developing pulpitis, but this one fortunately did well. And that's that one.